First of all, I just got here at around 2:30 and quarter after 2, and so I apologize for missing much of the talks today. I'm really pleased with the brilliant presentation that Mr. McKay made. It shows his articulation and his ability as Miramichi. We should be all proud of him. He outlined everything that we could possibly ask for today. First of all, I want to say to you, Madam Dubé, that I'm proud to be here, but I'm also proud of you. You are in public life, and we as New Brunswickers should be very proud when anybody gives themselves to public life, and it's very important for us. Whether or not we agree with your opinions at times, you still deserve credit, and I'd like everybody to give you may have some anxiety today towards you, and we are not in any way trying to provoke issues. We're trying to discuss them. First of all, I think that the issue about the trauma and the boundaries are somehow linked together in my mind, and also the removal of the board members. So they've been brought up to you, and you're going to have to digest that yourself, what you think. But we as the public who are here today believe that they are all linked. We believe that this is in some way a degradation of our possible regional status, which ultimately will affect jobs in our area from Rogersville, from Niguac, and also from the Bay. But I'd like to point out some issues that when I look at it that are important from a perspective differently than perhaps that people have noticed. And I never quite understood why the trauma center was initially looked at by the Hay Group, and noticed that there were some issues with orthopedic service in the north, in particular Campbellton and in Bathurst and Miramichi. By relocating a trauma center to one area to level 3 is not going to solve any problem, because it's going to still have people trucked around in ambulances, and still they're going to have to go either from Campbellton to Bathurst or from Miramichi to Bathurst. And I have a hard time understanding how that seems to be the norm up here, when in Moncton they can't even transfer one patient from the Dumont to the city hospital, which is 3 miles away. So that to me seems like I know that the North has always had a more difficult time geographically. New Brunswick is spread out, and it's a very complex problem how to deal with health care in this province with so many cities geographically separate. So when they looked at the trauma center and putting it in Bathurst, I thought to myself, they moved along. The Hay report said that it should go to Bathurst, and then perhaps we'll look at that a little closer, and how would we do that? We would, expand Bathurst Hospital, expand services, expand specialists. But, I got thinking to myself, well, that seems kind of bizarre that you'd want to do that when the Miramichi Hospital has a floor of long-term patients with about 40 patients waiting for a nursing home, and that we at the same time could easily move those patients out to a nursing home. And then we'd have space. You wouldn't have to expand the hospital. All we'd have to do is hire a third orthopedic surgeon, and we could be the trauma center of the South. Hospital, there are 40 people at least waiting for nursing homes, and they've initiated a petition to get long-term care and expand our hospital, our nursing home beds, I should say. And we have about 7,000 signatures asking to expand the nursing home beds on the Miramichi. My belief is that they should take Mount St. Joseph and amalgamate it with the nursing home, Miramichi Senior Citizens Home, and put them into two and expand the number of beds. There's some ideas different than that on the Miramichi, but regardless, just as Mr. McKay says, the Miramichi has not gotten the number of nursing home bed expansions that other communities have gotten in New Brunswick. So I don't understand why that is. So we could easily support a trauma center. If we just got the beds out of the hospital, we could put sick patients in there. I know, and I just want to bring it to your attention, and I've worked in medicine now, this is my 29th year, and I've worked in every part of the hospital. I've worked in ER almost full time, and CCU, hospitalists, all of these areas. And you know, I know that the trauma program started after Donald Thomas, a gentleman, I believe I got his name correct, from Carrick, Charlotte rather, and that area, after he had some difficulty getting his service because of various issues. But I want to point out to you, and you may not realize this, that he is not the first or the only person that has had such issues. As a physician who refers people constantly to more specialized centers in the province, it is always an issue. It doesn't flow easily. Many times you have to try one hospital, another hospital beside it, another hospital in another city. And I want to point out there are many patients that have had that difficulty to get there. So putting the trauma center just because of him in Bathurst is not really fair to those other patients at many other places who have had the same difficulties. The issue also has been raised by Mr. McKay about Égalité Santé and Dr. Hubert Dupuy and his wish to have people vacate Horizon for Vitalité. To my mind, that seems what is happening is the tail of the dog is wagging the dog now and telling everybody what to do. I'm totally against that. We are a bilingual province, not a unilingual. Hospital is one of the best examples in the entire province of an English community surrounded by 3 Francophone communities that love to come to our hospital and love to top-notch hospital. There are services that we don't offer, but many of those services are offered by surrounding hospitals, and I might add that those hospitals are such as the Bathurst Hospital, Schiller Hospital, is serving our patients with nephrology, and those patients there are getting service on the Miramichi, and they are English patients and they are French patients, and they still like to be served on the Miramichi. We would like to expand our nephrology clinic on the Miramichi. There are many patients having great difficulties here accessing nephrology clinics here. They have to drive to Bathurst for nephrology dialysis 3 or 4 times a week in extremely difficult situations, winter driving, financial issues. We would like to see nephrology expanded on the Miramichi. And we would love to have it taken over by our own regional hospital. And I know that is an issue because you have like to have specialized nephrology services in Bathurst with Dr. Hickey and Dr. Robichaud. But regardless, we would like to expand at least the clinic on the Miramichi.